So if a child develops signs or symptoms of COVID-19, so there is a checklist on our website at kflaph.ca, basically includes the typical symptoms of fever, cough, increased shortness of breath, or any respiratory symptoms, plus or minus any symptoms from the tummy, such as nausea, vomiting, and diarrhea. If it occurs that the child had these symptoms in the school setting, the child will be isolated from others, and there's protocols to enable that to happen. The parent would be called. We would suggest you contact your healthcare provider. You may also be immediately told to go to an assessment center, one of the COVID testing sites, and be possibly tested. So these are symptoms of COVID-19. If you have a test that turns positive, our lab has good capacity and quick turnaround time. So generally, it's less than 2 days from the time of assessment to being notified of a positive test. Public health gets notified, and we will contact you on next steps. So staying home from school for normal is 14 days from the time of the test or symptoms onset. We would notify anyone else. So we do a 3-hour risk assessment on the phone with the parent, identifying when the symptoms started, how they started, where they could have possibly been exposed. If we think there's any risk in the classroom, we would, through partnership with the school board, notify anyone else in that class setting, and we would provide advice to them, most likely to stay home for 14 days to monitor signs and symptoms if we think there was a risk of exposure in the classroom. Then, for an outbreak to be declared within a school setting, we've been given guidance that if we have 2 cases in a school with a child or a worker in that environment within a 14-day period where we think that the child or the worker acquired the infection in the school setting, an outbreak is declared. And we would potentially further test other individuals in that setting. But that's the general process. When we receive a positive test, you will be immediately notified by KFL&A Public Health, and we will be doing our investigation. Our investigation team asks the questions to figure out where the infection could have been acquired. If your child tests negative, so they had a fever, a cough, a runny nose, and the virus season has already started, we've got rhinovirus circulating now, so there are children with runny noses and fevers and coughs, and the vast majority of tests in our environment are negative. We would ask that all your symptoms resolve, so the fever, the cough, the runny nose, wait 24 hours, and then that child's able to go back to school. You can contact your healthcare provider for further guidance on that, but that's the general rule: complete resolution of symptoms, wait 1 full day, and the child can go back for resolution of respiratory symptoms.